Welcome everyone for today's webinar. So we are just going to start the event now. My name is Sonia and I'm from Empower School of Health. I am working with Empower from last 1.5 years now, and I'm working as a coordinator. I basically engage and plan, organize webinar for the organization along with our partners. And I'm privileged to announce Morton, who is our country ambassador in Zambia. Morton, if you can just take it further from here. Morton, I can't hear you.
Hi, Sonia.
Is my voice is audible, Professor Andy?
Yes, you're fine. Morton is still on mute.
Hello.
Yeah, Morton, can you hear me?
Yes, I can.
Thank you so much. So you can just take the slides from here. You can just carry on with the presentation.
So thank you very much, and good afternoon, everyone. Good morning to those of you who may be outside this continent, probably in a place where it's still morning. Good evening to a few people who may be in areas where it's still evening. As Sonia mentioned, my name is Morton Kunga. I'm an ambassador with Empower School of Health. We're excited today to have this webinar with the Pharmaceutical Society of Zambia. It's the first of its kind. And thank you very much, everyone, for joining in. Very soon we'll be calling upon the Pharmaceutical Society of Zambia to introduce the leadership there, and also we see how we move forward with the program. So the topic under discussion today for this webinar is strengthening immunization supply chain management and preparing for COVID-19 vaccines. As you may be aware, we are having the pandemic, and you know that Zambia is not spared as well. So we'll have a few people who will do some presentations, but just to highlight the fact that this webinar is attracting 10 CPD points. So to everyone who's attending, you'll be privileged to receive a certificate which will be used for CPD, and it will accumulate 10 points. Next slide, Sonia. Yeah, so just a few things that we need to be mindful of. Let's ensure that we mute our mic, and if possible, turn off the video, unless maybe you are given an opportunity to speak. That is when you can switch them on. We are advising that we ask questions using the chat box. And if you have an intervention, you raise your hand. You can see the icons. Participate in the poll. So time and again, you'll be seeing some questions in the form of questionnaire. So we are advising that we all participate. It's a multiple choice kind of questionnaire. So when you see those questions, just respond if your answer is A. For instance, if we are asking whether you are male or female, you just respond and submit your responses. We are recording our webinar, and that entails that the presentations at one point will be available and will be able to share with all the participants. Kindly feel free. Kindly fill in the feedback form. We have the feedback form, which at the end of the day, we expect that you can fill in, and we hope to use the information from that feedback to improve our webinars in future. Next. Yeah, so I mentioned that whenever you have an intervention, that is when you can switch on the camera. And I've also highlighted the fact that let's make sure that we mute. You may have, some background noise which may disturb other people who are participating in the webinar. So let's also make sure that we adhere to the scheduled timings, and this is especially to our facilitators, people who will be presenting, so that we work within time. Yeah, so the main objective of the webinar is to understand the importance of supply chain management issues pertaining to immunization. And I've already mentioned we are focusing on COVID-19. So we know that most of us, we do some form of supply chain management, but we are aware that COVID-19 is new. And the fact that we will be receiving vaccines, it's very important that we are ready to take up the challenge, so that we are able to operate efficiently. Yes, yeah, so let me take this opportunity to introduce a colleague who is my co-moderator. And this is no other than Dr. Jimmy Hanzoma, somebody we know very well in Zambia. He is a clinical pharmacist and a management expert practicing pharmacy here in Zambia. He is specialized in general pharmacotherapy with a bias in obstetrics and gynecology. He has 12 years of practice in the public sector in Zambia, where he's been involved in a lot of mentorship programs for the Ministry of Health and American International Health Alliance. He is serving as honorary lecturer at the University of Zambia School of Health Sciences and Cavendish Medical University. I should also mention that Dr. Hangoma is also the head of department for the pharmaceutical services at Levi Mwanawasa Medical University. And also just to highlight that he happens to be the vice president for the Pharmaceutical Society of Zambia. Dr. Hangoma, are you in the meeting? You are welcome.
Thank you, Mr. Kunga, for that welcome remark. Thank you so much.
And I'd want you, please, to feel free so you can take over from this point.
Okay, thank you, and good afternoon, ladies and gentlemen. So the first task is that participants kindly fill out that poll. So we would want to get some feedback from there, so that we get some analysis of the poll. So as Mr. Kunga highlighted, so these are just optional questions. Okay, yes. So let people continue selecting. We've got a few minutes to do that. Okay. So far, we are at 86 participants that have already filled in. Okay, a few more seconds, a few more minutes. A few more seconds. Okay. Thank you for that, Paul. So it shows that in this meeting, we have 73 males so far, representing us 63%, and then we've got females at 42, that's 37%. And in terms of age, so we have those that are less than 30 years at 37%, which is 42 in terms of absolute number. And then between 30 and 40, we've got 51 participants. And then between 40 and 50, we've got 17 participants. And above 50 years, we've got 5 participants. Okay. In terms of the geographical region, so from Southern Africa, from Zambia, we've got 93 participants, representing 81%. From Southern Africa, that's 6 participants. Central Africa, we've got 7 participants. West Africa, we've got 5 participants. And then outside Africa, we've got 4 participants. In terms of the academic background, so medicine and dentistry, we've got 1 participant. Pharmacy, we've got 99%, which represents 86%. Nursing, we've got 1 participant. And then any other health or life science profession, we've got 1 participant. Okay. So in terms of okay, just a sec. Okay, in terms of management, engineering, and other, there's no one. And then in terms of the supply chain management, we've got 10 participants, and then others, we've got 4 participants. In terms of the education background, so the majority, they've got bachelor's degree, which is 67 participants, and then 26, they are master's holders. We have no one with a PhD that participated. In terms of where people work, the majority, which is 45%, they work for Ministry of Health or other government bodies. And then we've got those that are working under UN, 3 participants, donor 1 participant, and then international or national NGO, we've got 15%. We also have the private sector standing at 45%, and then others at 7%. Okay. Thank you for participating in this poll. So could we go to the next slide? Okay, so now I'm going to talk about the Pharmaceutical Society of Zambia, which was formed in 1980. The Pharmaceutical Society of Zambia is a non-political and non-religious professional body, which says to represent the interests of Zambian pharmacists and pharmacy technologists. It coordinates the activities into an organized forum for association with members, other professionals, affiliates or affiliated bodies, such as the Hospital Pharmacists Association of Zambia and the general public. So the main aim of the Pharmaceutical Society of Zambia is to ensure that the highest standards of pharmaceutical training as well as practice across all sectors are maintained in order to ensure that the nation receives the best pharmaceutical care and practice. So this is the highest organ. The highest organ of this society is the National Council. And so all provincial branches and affiliate organizations, as well as sector groups, are represented in the National Council, and they've got the voting rights. So PSZ representatives on organizations that PSZ is affiliated to also participate in the council. So if there are any other organizations where we send our members to participate, so they are also part of the council. So the council basically is also responsible for all the decisions and directions of the National Executive Committee in between the annual general meetings that we do hold. Next slide, please. Okay, so in terms of the leadership for the society, so currently the current president is Mr. Kennedy Saini, and has introduced the vice president, that's Jimmy Hangoma, and then the national secretary is Mrs. Francesca Mwamba, and then we've got the national treasurer, Mr. Emmanuel Mlenga, and then we have the Farmers Technologies representative, Mr. Oliver Ngandwe. Next slide. Okay. Thank you.
Thank you, Doctor. Now I would like to carry forward this presentation to Professor Andy.
Okay, greetings to all. I've been asked to say a few words about the Empower School of Health. I know we are known to many of you because you've undertaken the online course. Next slide, please. A little bit about Empower. There are 5 major areas, and already we have reached across more than 1 million hours of capacity building. We achieved that huge number by using online learning, and that really has been the revolution. Long before COVID hit, we were already doing online learning because it gets the cost down and it enables people to stay in their jobs. They don't have to give up their job to go to university to learn. They can learn with the job at their own pace online. 5 major areas: digital learning, learning management programs, designing e-learning courses, delivering solutions to particular targets that can be anything throughout the health system, from waste management to nurse training, and measuring the impact of the learning. A particular feature of Empower is not that we teach, but we encourage countries to develop their own learning capacity. And you see on the right, many of our clients, UN agencies and central governments and pharmaceutical societies in country. Next slide, please. We are headquartered in Switzerland and India. Switzerland, of course, to be in Geneva with the UN agencies and WHO. India, because that's a low cost base and a huge population base, which we use for our training needs. And we have links across many parts of the low-income country world. Particularly for me, based in Thailand at Mahidol University here in Bangkok, English language training programs through Kathmandu in Nepal, and again through Africa and beyond. Next slide, please. Good. 5 major areas: global health leadership. It's not enough to know what to do. We have to be able to go out there and lead, to drive the major reforms and initiatives that we need. Global health supply chain, particularly this year around COVID-19, but not forgetting HIV, TB, malaria, nutrition, antimicrobial resistance programs, many activities around supply chain. New product introduction, still lagging behind. New medicines, bedaquiline for TB was introduced 5 years ago. How many countries have actually adopted it? One of our major areas, new product introduction, accelerating the speed at which we adapt to new products. Medical lab diagnostics, a largely forgotten area. HIV test kits, nobody wants to talk about them. Without that diagnostic, we can't drive programs forward. Healthcare workforce strengthening across the range of all health professionals. Okay, yeah, next slide, please, go ahead. Public health stakeholder framework, yes, we work with a huge amount. Again, our aim is not to teach, it is to empower, to have countries develop their own learning programs, their own capacity building programs, so that in future they will develop, not to have an external agency all the time to come and drive those forward. And that means reaching out and interacting with a huge range of stakeholders. Next slide, please. We have a truly international faculty and staff members, a full range from north, south hemispheres, east and west across there. And of course, we have His Excellency John Kufuor, former president of Ghana, to lead us on management and leadership issues. Next slide, please. What makes Empower unique? Really 3 areas. Our e-learning technology. How can you possibly afford to undertake a postgraduate qualification? Typically in the West, that's $13,000 to $15,000 just in fees. That's unaffordable. We can get that cost down. We can get more equitable access by using e-learning. Unfortunately, many people think that e-learning is just putting a few slides on the internet. That is not e-learning. E-learning is a full range of integrated activities, and we bring that technology and ability. Our team, we have a genuinely international team. We use country ambassadors to ensure that we do things in keeping with the culture and the structure of the country. And of course, our funders and partners, where we try to lever funding resources for country needs. Next slide, please. There are many courses available, from short 2-month courses to the 18-month postgraduate certificates. Full range, all in partnership with different organizations. Please take some time to look through the slides afterwards, look at courses that might be applicable to you, that might be of interest for you. Some courses are free of charge. Next slide, please. It's time for another poll. If we put the poll on screen, please. And for question 1, it's a single choice. Have you ever dealt with immunization programs before? Have you received any training? Do you have a relevant training in emergency responses like COVID, like pandemics? And at what level are you working? If you please respond now, we'll just take a minute because I think you can go faster on this poll than on the first one. So these are all single choice questions. Coming along quite fast now. Good. People are getting more used to polling. And the polling is important because we adjust the material we present during this webinar and future webinars according to the polling results that we receive. Just coming past 50% now. We'll try and take it past 75%. You see, we have a lot of people who have experience, nearly 50% of experience in immunization programs. That's good. Later on, I'll be highlighting the similarities and the differences for COVID vaccinations. Education, quite good. About coming on for 50% have received some training in programs. That's good. Okay, we're past 80% now, so I think we can halt polling there and we can move on. Do you feel you've got the relevant knowledge? Only about 50% of you feel that you know enough to handle public health emergencies, pandemics. It's an area that's been neglected in the past. We have to look more because it's for certain that pandemics are not going away. There'll be more coming along in the future. And most people I see are, okay, we'll just scroll down, are working at managerial, but evenly split between technical and managerial. Okay, thank you very much for those polls. we go on now to the next slide, please. I think then perhaps I'll introduce Constance. It's a long time since I was in Zambia. It's more than 15 years since I was last there, but I started work in Zambia in around 92, I think, long time ago. But for Constance, she is a pharmacist pursuing a master's in public health at the University of Zambia and working with the EPI, Extended Program of Immunization. Experienced in planning and management and implementation of immunization activities, so a real expert for us today. Involved in management and vaccine safety, particularly important as we introduce new vaccines, outbreak responses, and preemptive vaccination programs. Experience of working with the major agencies like WHO, UNICEF, and Zambra. So welcome, please, to Constance Scala Bonfada, and I pass over to you now.
Miss Constance, if you can just unmute yourself.
Well, thank you very much. I'll take this opportunity to take everyone through the presentation from my side. And the presentation layout will firstly introduce the Ministry of Health, the institution for which I work. Then I'll highlight the role that the ministry has played in strengthening the immunization program. Then I'll conclude with plans for COVID-19 vaccine deployment. And just a correction on my name, I'm Constance Scala Banda. Next slide, please. Okay, as we are all aware, the Ministry of Health is guided by a mission, a vision, and also a goal. Then we also have key principles on how exactly we'll have to implement or conduct the various activities that we have to try and reach our intended goal. So the mission of the ministry is to provide equitable access for cost-effective quality healthcare services. And these services are supposed to be brought as close to the family as possible. And by fulfilling that mission, we have a vision of a healthy nation where we have productive. The overall goal of the ministry is to improve the health status of its people and also have these people healthy enough to contribute to the socio-economic development. Then the main principles that drive the Ministry of Health, having primary healthcare approach. We know that especially in the reforms that the Ministry of Health has had to go through, we have them centered with a focus to strengthen primary healthcare. Then we also have the principle of ensuring that there's equitable access to various services and commodities. And this has to take into account people who are not as advantaged to access the services. So the ministry targets to ensure that there's an equitable platform for access to the services. Then we also try to target affordability and cost effectiveness in the interventions that are provided. And we also try to ensure that as we implement the various interventions, there's accountability. Then we also focus our strategies on partnerships, both with line ministries and also with cooperating partners. And we also try to ensure that there's decentralization and leadership at the various levels where the Ministry of Health operates. Then we also do not neglect the aspect of clean, caring, and competent healthcare environment, because we know that such an environment is very important for the health outcomes. Another focus or target that the ministry has, and looking at the time period that we are in, is to ensure that we attain sustainable development goals and also the various health priorities that we have set. Next slide, please. Okay, so now we try to zoom in and focus on what role the Ministry of Health has in strengthening the immunization program. As I had earlier highlighted, the Ministry of Health has really focused its efforts on the primary health approach. And this is through provision of a continuum of care and emphasizing that the systems that we have are adequately strengthened to ensure that even as we target this primary healthcare approach, we are providing services through the systems that are available. So currently, the health service model has been re-engineered, and the focus is firstly on primary health, on health promotion. So we try to provide information and try to ensure that we have put health promotion as the main target. Then the next focus is on disease prevention, because we know that prevention of disease saves us the various costs that come with the curative and rehabilitation services. So just as I am saying that there's this focus on the preventive side, for those that are not able to be catered for in this prevention, areas of curative and rehabilitation are not left behind. They're also closely catered for. So we realize as well that most of the activities that are implemented in the primary healthcare, and also those that have to deal with health promotion, disease prevention, are closely anchored with engagement of the community. We realize that we have to really strengthen our community-based preventive health services rather than curative. And so with the immunization program, just to emphasize the priority that government has placed on strengthening immunization services, we note that there are 3 dedicated budget lines that have been supported at national level. And these have to do with the procurement of vaccines and supplies, procurement of under 5 cards, of which we know that vaccination is one of those areas that are monitored on these vaccination cards, and also a budget line on cold chain equipment, for which if we do not invest in the cold chain equipment, we cannot talk about the immunization program. Thank you. Next slide. We've spoken about the national level, but that does not mean the provincial and district levels have been left out in ensuring that we have budget lines that are supporting the immunization program. So for provincial and district level, we also have some budget lines that support the expanded program on immunization in general, with also an emphasis on new vaccine introductions. We've noted that in the recent past, I think in the past 5 years, we've introduced more than 3 vaccines into the program. So there's this line at provincial level that helps to reinforce the program. Then at district level, there's a budget line that supports outreach. We know that some of our services for the immunization program, we have to reach out to our intended target population through outreach. So there's that dedicated budget line for that purpose. So in also looking at how the ministry has strengthened supply chain, we note that the ministry has incorporated pharmacy personnel to be able to manage the immunization supply chain. So the pharmacy personnel have been incorporated in the provincial, mainly provincial and district level teams to be able to contribute the expertise to this part of EPI, which is very important. We know that availability of the commodities in the right quantities and also in the right product and all the other attributes that come with ensuring that we have an efficient supply chain are adequately handled by people with the right expertise. Another area has been on ensuring that we have a real-time web-based stock management system that will be able to help us to effectively track where exactly our stock is and how exactly our stock is moving through the supply chain. So we have this rule-based stock management tool that helps us manage, forecast, and quantify for our needs. Then we also have periodic reviews of the supply chain, and then we develop costed plans for which we try to see how we can further improve the status and performance of our supply chain. Then currently, we also have a project that's being implemented in Southern and Western Province. And the focus of this pilot is to ensure that we have efficiencies within our supply chain and ensure that we have more stock being available in the last mile so as to reduce on stockouts that are reported mostly at the last mile. Next slide, please. Okay, now looking at the main agenda or purpose of our call, we cannot go without talking about COVID-19 vaccines. So we'll highlight the plans that are there for the COVID-19 vaccine deployment. So just like most of the other countries globally, the country has developed a plan for COVID-19 vaccine deployments. And this plan has been developed and shall be executed in line with the global recommendations. So that's mainly based on the guidelines provided by WHO and other cooperating partners. This plan has been developed, and a coordination structure has been embedded within the incident management structure for the COVID-19 response. This means that the COVID-19 vaccine deployment is part of the COVID-19 response, and immunization is a pillar that's embedded within the COVID-19 response. So the plan articulates the justification for COVID-19 introductions. It highlights what the objectives are that we intend to achieve with the COVID-19 vaccine deployment. It outlines the strategies and what key actions need to be undertaken to ensure that we successfully roll out this plan. So even as we roll out the plan, we have a readiness assessment that tries to give us checks and balances to ensure that we have the right systems and places, and actions are also being followed to ensure that we have everything ready with us, even as we plan to introduce the vaccine. So the key pillars that are in the immunization section, or the immunization parts for the vaccine, parts of the COVID-19 response, we have planning and coordination, we have regulatory pieces, we have issues of prioritization. We know that many countries are seeking to access the COVID-19 vaccines, and the vaccines may not be adequate for everyone at the same time. So it's important that we prioritize the different target groups of who receives the vaccines when. So that part is also being attended to. Then we also have parts looking at service delivery, parts looking at monitoring and evaluation to do with our coverages and also any data issues related to the vaccine deployment. Then we also have a section that has to deal with vaccine cold chain and logistics. We have a part looking at safety surveillance. And lastly, but not the least, a part looking at issues of demand generation and communication. And so the vaccine deployment, for the vaccine deployment, this is largely being informed by the local epidemiological data that is in the country. So the various areas that are being attended to by many other expertise. For example, we have a national immunization technical working group that gives advice on immunization program issues, as well as also the technical people that are looking at the issues of vaccine deployment. All this is being done with consideration of local epidemiological data. Next slide, please. Okay, so yes, there are supply constraints, and we have a prioritization matrix which highlights who exactly we are going to target for the COVID-19 vaccines and when. And all this prioritization is guided by 6 principles. And these principles, not just for Zambia, but have been highlighted globally. And these principles have to do with human well-being, global equity, reciprocity, equal respect, national equity, legitimacy, and these are not only guiding the prioritization, but also the allocation of vaccines. So Zambia will deploy the vaccine deployment once all the necessary processes and stages have been concluded using a 5-tier system. And these 5 tiers, we have tiers A to E. The first tier is looking mainly at ensuring that those who are essential in sustaining the COVID-19 response are well catered for. Then in tier B, we also look at those who, in tier B, we are looking at those who are essential in maintaining core societal functions. We want to ensure that these are well catered and cared for, to ensure that we do not have any disruptions in core societal functions. Then in tier C, we are looking mainly at those who are at greatest risk of severe disease and death, and their caregivers. Then in tier D, we are looking at the population. We are looking at the population in congregate settings. And in tier E, that's where we are trying to target the rest of the population. So as we may know, the vaccines are catering for the age groups at the moment. We only have one that starts from 16 years and above, but most of the vaccines that are currently available are targeting those who are 18 years and older. So this is the tier system that is being looked at, and the focus or choice of selection was to try and ensure that there's a cut in community transmission. Thank you. Okay, so now where, as pharmacists or as pharmacy personnel, do we fit into the COVID-19 vaccine deployment? Based on the different pillars that I earlier highlighted to be part of the immunization section of the response, We note that pharmacists' role is included but not limited to regulatory preparedness, processes of facilitating vaccine clearance processes, advising on vaccine-related issues, such as choice of vaccine for the target group, then also on the management of the immunization supply chain. We know that this includes also traceability of vaccines. Then also in the areas of vaccine safety surveillance. So these are the 5 main areas, but these 5 main areas do not mean that these are the only areas where pharmacists have a role in the COVID-19 vaccine deployment.
Thank you, Madam Constance Sakala Banda. It's my privilege now to introduce a seasoned pharmacist in Zambia. That's Mr. Lamek Kachali. He's got over 18 years of developmental experience working in the public health sector, focusing more on making essential medicines and medical supplies available in health facilities and managing supply chain programs. He is currently working with the USAID Global Health Supply Chain Program, Procurement and Supply Management, as a Director, Strategic Plan and Governance. Like I said, he's a pharmacist in Zambia by profession, and he's an effective team player who values promotion of optimal utilization of available resources in the public sector. Ladies and gentlemen, welcome Mr. Lamek Kachali as he makes his presentation. You're welcome, sir.
Thank you, and greetings to everyone. So next slide. Okay, I'll give key highlights based on from the Pharmaceutical Society of Zambia perspective on how we are progressing, especially to do with strengthening the immunization program. So with regard to the society, I think this was alluded to through the introductory part by the Vice President. The society contributes mostly in terms of supporting the continuous improvement of the pharmaceutical standards, which are centered on strengthening the healthcare delivery in the country. The society has always also advocated for equitable access of medicines, vaccines, medical supplies for all the Zambian citizens are made available. So currently with the COVID-19 pandemic, the society has realized that there's need to have a robust and agile supply chain, which is critical in enhancing availability of key commodities. So this is an aspect where members from the society have been pushing this agenda to ensure there's enhanced commodity availability so that we can address the pandemic. And these are activities that are constantly being done or being held through the various interactions with the Ministry of Health and key partners in ensuring commodity availability. We can go to the next slide. So in terms of key supply chain considerations that we've been looking at to ensure that this aspect of making commodities available is come to fruition. We all are aware that there's competing priorities for scarce funding devoted to public health programs, and mostly we've seen that there's been insufficient finances dedicated to supply chain system strengthening activities. And this is where we've noted that funds have been inadequate, and mostly this has affected how supply chains are being managed. Then obviously with the inadequate funds, the other issue has been with the various commodities that are required to meet the. So we now have, we already have issues with having the essential medicines readily available. This where the challenges have been noted. We have the ARVs programs, which are currently being fully supported through support from partners. And this is also a challenge in the sense that we need to start seeing how best do we own these programs and provide the necessary resources. Then again on training, obviously, in order to have a supply chain which is very effective, all staff have to be adequately trained in the management of whether it's vaccines or any other commodities. You need to have adequately trained staff that will ensure that they are constantly looking at the available. I mean the logistics system reviews, of which inventory control systems play a key role, understanding the demands that are being created out there, forecasting and supply planning, ensuring that consumption trends are tied into supply planning. So the products that are being consumed, there's already a plan for them to come in country. So these are some of the things that are critical in factoring in, even as much as we are heading towards vaccine accessibility for COVID. These are standard considerations for every product that comes into the country. Again, we equally need to factor in infrastructure and transportation. By this, for the vaccines, obviously, we need to look at the cold chain infrastructure that is existing in the various health facilities. At the same time, the central warehouse and regional warehouses, in terms of them being able to handle cold chain and storage and distribution. So on the distribution part, obviously, we're trying to look at available vehicles. Some of the facilities are inaccessible, especially during certain seasons during the year. So it's always important to look at different transport vessels that can ensure that commodities are made readily available. Again, the other key consideration is information management to enhance end-to-end visibility. I think without this, it becomes a big challenge of sustaining the supply chain gains. There has to be information flow within the supply chain. Otherwise, we cannot be assured of having a strengthened immunization program if we are lacking information flow and real-time information flow. So these are quite critical, and from the society's perspective, these are components or aspects we've been trying to bring to the agenda every time we're engaging ministry and the partners. We can go to the next slide. Okay, so this is just on the way forward. How do we ensure that we move forward with what we're trying to advocate for? So what is critical is obviously there has to be adequate allocation of resources for supply chain operations. We can't do much if resources are limited. This is really the hallmark of the operations. Finances have to be there. There has to be a budget line for specifically inclined towards supporting supply chain activities. Then again, we need to have a dedicated team that is need to strengthen focusing on supply planning activities to obviously enhance commodity availability. There has to be a team that is looking at this, the focus and planning for supplies on a regular basis. This should not be a one-off activity where it's only done once per year. It's supposed to be a continuous process. Again, I did mention of end-to-end visibility. A robust system has to be in place that ensures that there's this visibility of supplies from the manufacturer all the way to the end user. I know we are right now having some meetings with key stakeholders regarding the GS1 for traceability of pharmaceutical supplies. This is, I think, it's happening in some of the other countries. So Zambia is equally on track, trying to engage on GS1 activities to enhance that. Then on the way forward, again, on cold chain management and in enhancing accessibility, this is very critical. We all know the various vaccines that are out there, and we all know our capabilities. There are vaccines that need to be stored at -80 degrees, -20 degrees. So all these are considerations that need to be factored in as we move forward, because we do not know whether where we're going, the most effective vaccine might be the one which requires -80 degrees Celsius. Are we going to handle that? So these are some of the things that we need to be considering, as that this is a new pandemic and we all are learning every day in terms of what's happening. Against continuous training of staff, this is critical in supporting the supply chain, and also leveraging resources with key stakeholders that are involved in supply chain, including the public sector. This is of paramount importance in ensuring that the utilization resources are optimally utilized. We do not want to have two partners supporting the same thing. There has to be leveraging. One partner focuses on training staff. Another partner can come in to look at supporting the vehicles or delivery vans. Another partner can come into infrastructure. Another partner supporting the actual procurement of vaccines or any other medical supplies. So there has to be constant engagement with partners to support the strengthening of immunization programs. So I think that should be my last slide. Thank you.
Okay, thank you very much, Mr. Kachali. We should move on. Just before I introduce Professor Andy Baraclough, just to say that those with questions, drop them in the chat box. We may not have enough time, and I'll also ask all the presenters just to take time to look at those questions, just in case we have time. We may ask you maybe to summarize in 1 or 2 minutes. So at this point in time, I'd like to introduce a man who has been very instrumental to the Empower School of Health. He's a professor of public health and director of training at Empower. Professor Andy is one of the co-authors of the Yellow Book, Managing Drug Supplies by Management Sciences for Health and WHO. He has over 25 years of experience of working with major international funding institutions and bilateral donors. The main focus of previous experience includes effective management of pharmaceuticals, vaccines, medical commodities, and especially the implementation of programs for the introduction of new medicines and vaccines for neglected tropical diseases. Professor Andy, you are welcome, and please take over.
Greetings to all and welcome. First, my apologies to Constance for mispronouncing her name. My memories of Zambia are a little fading now. We're running about 30 minutes late, so I'm going to go quite fast through the presentation. There's a lot of information on the slides. The slide deck will be provided to you, so you will have these links. You can follow up on this information. Firstly, the key documents for COVID-19 vaccine planning, the WHO guidance on developing a national deployment plan. Zambia already has a national deployment plan available. Issued in February was more detailed technical guidance on the supply chain. Many people have not yet seen that. Please reference that. There is detailed information there. Those of you familiar with EPI, the Extended Program of Immunization, will already know the WHO documentation, how to calculate vaccine volumes. Within the COVID-19 guidance are the packed vaccine volume formula and individual figures. So please reference those. Next slide, please. Well, why do we need all of this planning just for COVID? We've been doing EPI for years, decades of undertaking. We've already got national vaccination plans. We know how to run a cold chain. We know how to do vaccinations. We've been doing it for years. Why do we need all this extra planning and all this extra fuss just for COVID? Next slide, please. What's so special about COVID? The key point about COVID is the scale of the operation required. Most EPI programs focused on infants and newborns. That's around 3.5% of the population, because most of those vaccinations are in the first year of life. Yeah, they extend onward to year 5, but the focus is really around year 1. For COVID vaccine, we're trying to reach 30% in the first year. That's 10 times more volume of vaccine to go through the system. That's the key point, why we need so much planning, why we need so much preparation to COVID. And beyond that 30%, on to 60%, 70% of the population. Yeah, next slide, please. But how can I plan anything? I don't know how much vaccine we're going to get. I don't know when it's coming. I don't even know what type of vaccine it is. What are the storage conditions? They're different for the different vaccines. And what's the volumes? And how much does it cost? How can I possibly plan anything? My message to everyone is failing to plan is planning to fail. Much of this information is now available, and it's becoming more available every day. Next slide, please. It is essential that we undertake detailed planning. The national plan is already done. More detailed regional and district planning is required. You can plan. You can use unit costs, unit estimates of what's available. And if the plans are not complete, COVAX, the supply mechanism, which I'll talk about in a moment, won't supply. There is a readiness assessment tool to check that countries are ready to receive the vaccine. Next slide, please. The situation is dynamic. In February, a lot of information was issued. More information is issued almost every day. The links are on the screen to be able to find more information about what is happening to COVAX vaccine supply and world vaccine supply. Next slide, please. Which vaccines? The link on the screen links to the vaccine candidates. In February, there were 255 vaccine candidates. In January, there were 291. There's generally a churn of about 50 every month. 25 drop out, 20 new ones come in. Well, why are there so many vaccine candidates? Because for all vaccine development, not just COVID, typically only 7% of vaccine candidates ever make it through the lab-based screening tests. They never get to clinical trials. Only 7% get through that stage. Of those that go into clinical trials, typically only 20% get through the clinical trials. That's 20% of 7%, which is 1.5%, which means from the current 255 vaccine candidates, we might expect 3 or 4 new vaccines to come to market. 12 vaccines are already currently in use. Next slide, please. How do the different vaccines work? There are different techniques, different technologies for each vaccine. If we start with one that many are familiar with, and that's the whole virus. This is the type that is used in polio vaccines, where you take a killed or inactivated virus. And that's a classic technique, and the ones being developed in China, Sinovac, are using that technique. Some use a protein subunit. That is, they use the glycoprotein spike from the outside of the virus. In order to deliver it into the cell, they use a delivery technique called solid lipid nanoparticles. It was a technique developed for delivering anti-cancer medicine directly into cells. The outside glycoprotein spike is encased in this nanoparticle, tiny little particle made of a lipid. For the vegetarians among you, all the lipids used are plant-based. There's no meat-based products there. And that gets it into the cell, and that triggers the immune system and development of antibodies. There are the RNA vaccines, which use a tiny amount of the RNA from the virus. They use only the tiny section which produces the external glycoprotein spike on the virus, the outside of the virus. Again, that is wrapped in a solid lipid nanoparticle. And that's how it's delivered into the cell. Those contain RNA, which is very delicate, hard to survive outside a cell structure. So they require very cold storage temperatures, -20, -70 for some. Finally, there is a viral vector, which uses a harmless virus. AstraZeneca used a virus which causes influenza in chimpanzees. They take out the reproductive element from it and they paste in the genetic code to produce the external glycoprotein spike from the COVID virus. Only the external spike, nothing else on the virus. The chimpanzee virus delivers that into the cell, which then triggers the immune system against this glycoprotein spike. Among the different types, most people are working on the viral vector because it's open source, published knowledge. It's a technique that was developed for Ebola vaccines. So it's wide open, all the information is available, most people are working on that. Using the solid lipid nanoparticles is very high technology manufacturing. Next slide, please. I said 12, in fact, one was added yesterday, so it's 13 now, vaccines which are in use. So far, 2 have emergency use listing from WHO, that's the biotech Pfizer and the Oxford AstraZeneca. It's expected that the Johnson & Johnson will receive the WHO listing very shortly. And those are in use in a number of countries worldwide. Next slide, please. How do they compare? Well, the Oxford AstraZeneca requires 2 doses. Efficiency depends on the exact circumstances, between 60 and 90% effective, and it can be stored at 2 to 8 degrees. The Moderna is an RNA vaccine, requires 2 doses, 95% effectiveness, must be stored at -20, and has a shelf life of only 6 months. The Pfizer BioNTech, again, is an RNA vaccine, 2 doses, 95% efficiency, must be stored at -70 degrees centigrade. The Russian Sputnik V vaccine is a viral vector, 92% effectiveness, stored at 2 to 8 degrees. Next slide, please. How does the effectiveness compare to other vaccines? On the left is seasonal influenza. influenza vaccines generally are around 60 to 80% effective. And we see that in the middle, the COVID vaccines are around 60 to 90% effective. That compares to items like measles at 97% and polio vaccines at 99%. Key point here is people get confused about the effectiveness. From a public health perspective, anything more than 50% effective will have a major impact on the pandemic. You don't need to have 95% effective vaccines for COVID. You do for measles. Measles is far more infectious. You need to be above 94% effective. For COVID, WHO has decided more than 50% will have a major public health impact. Next slide, please. What do they cost? These are indicative prices only. Prices vary hugely depending on the volumes of procurement being undertaken and who is buying and where it is going. It's widely believed the European Union pays less than $2.30 for the AstraZeneca vaccine. But it gives you some idea of the difference in cost between the different vaccines. Huge differences among the different vaccines. Next slide, please. What is COVAX? COVAX is a facility led by Gavi and the Coalition for Epidemic Preparedness Innovations, CEPI. It's really in two parts. One is a procurement mechanism to enable countries to buy vaccines. And the second part is a donation mechanism to supply vaccines to low-income countries. That's the AMC mechanism. So far, around $700 million has been raised. Doesn't mean you necessarily get the vaccines for free. Countries discuss with COVAX on their income level and what level they are able to pay on the system. So COVAX is useful for countries to secure supply using their own funds and then to receive reduced rates and free vaccines. COVAX is committed to supplying at least 20% of country populations. Next slide, please. How much vaccine is Zambia getting? Under the COVAX scheme, the initial allocation is 1.4 million doses. The link is on the screen. You can find the allocations for COVAX for all countries. Again, that's just the initial allocation. More is coming. Next slide, please. Where is the vaccine coming from? It's AstraZeneca vaccine. And for most of Africa, it's coming from India. Coming from the Serum Institute of India, SII, which is the largest by volume vaccine manufacturer in the world. So on this global map, color follows color. So most of Africa is coming from the blue, which is manufactured in India. And you see that Eastern Europe is different, Western Europe is different, Australia, and so on. Okay. What is the storage temperature in the WHO guidance issued in February? You will find for the different vaccines, not just the storage temperatures, but the shelf life, how long it can be outside the refrigerator, all the details you need for the program. So for the COVID vaccine, you can see Oxford AstraZeneca, 2 to 8 degrees, do not freeze. Stability is 6 months at that temperature. Unopened vials can be stored at 2 to 8 for 6 months, or up to 25 degrees for 2 hours. Open vials can be stored 2 to 25 for use within 6 hours. Okay, so very detailed information available in the WHO document. The link is on the screen to that document. Next slide, please. What is the packed vaccine volume, which you know you need to calculate how much storage space, how much transport capacity. Again, it's given there. Packed vaccine volume for Oxford AstraZeneca is shown on the screen and per dose. Next slide, please. Vaccine tracking planning, of course, you don't just need the vaccine. You need the syringes, you need disposal boxes, you need everything that goes towards a normal vaccination program. And you need to plan that, and you need to plan what you're going to do with the waste. The syringes, the waste vials, every item might require reverse logistics, moving it back to secure destruction. And there is guidance available on destruction of that as well. Next slide, please. Many programs have already undertaken their development, national COVID development vaccination program, but often supply chain is not detailed. And we need to advocate to make sure that supply chain is fully considered. Failing to plan is planning to fail. It sounds simple. Japan has wasted millions of doses of COVID vaccine, millions, because it's got the wrong syringes. They failed to plan. We can't have that. We must plan exactly what's going to happen throughout the whole of the supply chain and the vaccination program. Next slide, please. It's a massive undertaking. There is excellent guidance documents available. If you want to know more, there is a free online training course. It was developed for WHO Southeast Asia by Empower, but it's available to everyone. It's free, it's online. Next slide. Here is the link to that course. There are 9 modules, all aspects of supply chain for COVID-19 vaccines. Again, it's focused on Southeast Asia, but it's available to anyone who wishes to sign up and follow the course. Okay, thank you very much. I'll pass on now.
Thank you, Professor Andy. Now, I would like to announce our partnership with Pharmaceutical Society of Zambia, and also announcement of scholarship program, where we are basically announcing 1 full scholarship and 5 partial scholarship for postgraduate diploma in supply chain for English course. The course is here, as you can see. So, since we have recently partnered with Pharmaceutical Society of Zambia, so we have created a web page on their website. So if anybody would like to know anything about Empower, how many courses we offer, what all the courses are all about, they can simply go to Pharmaceutical Society Zambia website, or you can refer to Empower website, where you can find all the course details and all other relevant details. So let me just explain you how the scholarship will work. The original tuition fee for postgraduate diploma in global health supply chain is, for English version, is $2,500. And since we are having this collaboration with Pharmaceutical Society Zambia, so we will be offering 1 full scholarship. That means the fee will be exempted for 1 person. And there are 5 partial scholarship, and we will be giving scholarship for $1,000. So the final payable fee will be $1,500. And for others who miss the opportunity, they can enroll themselves with original price of $2,500. The process for applying for a scholarship program, you can either write us Empower on operations@empowerschoolofhealth.org and info@empowerswitch.org. Also, you can directly contact Pharmaceutical Society Zambia. You can coordinate with them, and then we can proceed with your enrollment. All application then will be reviewed by Empower and Pharmaceutical Society Zambia. You can also find the website link of Empower. Once the slide will be shared with you, you can go to the link which is mentioned on the slide deck. Thank you so much. That is all about. Now I would like to request Professor Andy to take poll 3.
Okay, if we can have the poll on the screen, please. And again, if you would follow the poll, it's single choice questions for immunization campaigns. And have you been involved in the COVID response so far in your country? And again, we'll try and take it through to around 50%. Just while we're waiting, I'll try and answer a few of the questions. The question is 1.4 million doses enough? No, of course not. That's the initial allocation. COVAX will be making allocations throughout the year as they get vaccine available from the manufacturers. Another question while we're waiting to get up to 75%. Is this vaccine for the first wave or the second wave? At present, all vaccines are for general COVID. There is no specific vaccine developed for the variants. Indications vary on how effective they are against the variants. We don't have enough data yet to be able to say. It is likely that vaccine variation will be taken into account in the near future, but at present, all vaccines are for general COVID. A little bit more to get above 75%, please, and then we can stop the polling. Okay, we're at 75%. I think we can stop the poll there. Immunization campaigns, I see most people have some involvement, 40%, but we have quite a lot. Again, nearly half not been previously involved in vaccination. I think you probably will be in the near future. Are you participating in COVID? A split there, about 50-50, yes, no. Has COVID vaccine been introduced into your country? 25% say yes, 75% say no, so I'm not quite sure about that. Have you found the webinar useful? Overwhelmingly yes on that. Good. Excellent. Then we can go on to the next slide, please. A certificate is available for this course that will be provided to you, provided you have registered for the course and you have remained online or attending throughout the course. Okay. We need to make sure that we have your email address. So please make sure you have registered on the online link for that. We have many questions asking us, will you get the materials? Yes, you will get the presentation materials. They will be provided to you. Okay, Sonia, do you want to lead off on the questions or have we got time for that? I see we're running quite late, but.
Prof, if, I mean, we can take a few questions if participants have.
Okay.
I can see there are a few questions that has been asked from Constance.
Yeah, I
Thank
see.
you for the,
Go ahead, please, Constance.
thank you for the opportunity. I think I'll quickly try and summarize the key ones that I was able to note. I think one of them was asking on the role of the private sector, as the COVID response has been a multi-sectoral approach. The private sector is not left out, even on the immunization part. So some of the areas that the private sector will be involved in is also on the pooling of research. I think also there's been mention of issues around areas of vaccine acceptance. So the private sector is also called on to assist also in that area, also on the provision of finances, provision also of services, as well as monitoring of vaccine safety when the vaccine is eventually rolled out, and also issues around supply chain in general, traceability, reverse logistics, as well as being able to provide the vaccinations. Then another common question was around the issues of cold chain, with the different concerns as to whether there's adequate cold chain in the vaccines have the different storage temperatures, and cold chain is a really critical component. So efforts even to try and expand the storage capacities and also just the cold chain around the various places started long before. I think we have an approval of a cold chain equipment optimization platform, which seeks to try and see how we can strengthen the cold chain at and seek to strengthen the cold chain at district and health facility level. So we have at least that cold chain equipment optimization platform to address that. With the COVID-19 vaccines, we're also currently in the process of applying for support to try and see how we can address the upper areas, that's the district, the province, and the national level. So for the various storage conditions, there's that. Then we're also in talks with various cooperating partners, and all these efforts are also just trying to supplement what government is already trying to do. Then on the parts for vaccine acceptance and hesitancy, yes, we all know and have seen various misinformation around the vaccinations that have been on various platforms. So we have a subcommittee that looks at issues of risk communication and community engagement, who are closely following community perceptions on the vaccines themselves, and developing a strategy and messages around addressing the issues and ensuring that demand is created for the vaccinations. As to whether we have a vaccine already selected or vaccines in country, we don't have any vaccines yet, and the rollout will depend on the various processes. I mentioned earlier to say we have a technical working group that advises on immunization, that committee, cabinet approvals. When these processes are concluded, as well as the key processes that are needed for vaccine introduction are completed, then we will be able to receive the vaccine. But the country has applied from the COVAX facility, as reference to Professor Andy's presentation, and also through the Africa Vaccine Acquisition Task Force team that has tried to secure some vaccines for the African Union. So those platforms have been used to try and secure an allocation of doses. And rightly so, as Professor Andy had mentioned, the 1.4 is the initial allocation through the COVAX facility, but we stand to benefit to up, and then also there's the support through the AVAT, the platform that we are seeking to access more vaccine doses. Thank you.
Thank you very much, Constance. I think we seem to be running out of time. So I think just to mention that the slides will be made available, and I think let us continue interacting. Some of the responses will still be provided, as I indicated that you just drop your question in the chat box. In this meeting, I think we are joined by the President of the Pharmaceutical Society of Zambia, Mr. Kennedy Saini. So I will allow him to say a word or two before we close our meeting. Mr. Saini. Is Mr. Saini in the meeting?
Yeah, I was trying to unmute myself, but the host was not allowing. Thank you very much, Morton. So mine is just a quick appreciation in less than a minute or so. So I would like firstly to thank Empower. It's very, very important, very wonderful webinar, and it's a great start. So many thanks go to Prof. Andy, Prof. Paul, Madam, and locally here, you, the ambassador, Mr. Morton Kunga, for this wonderful wonderful webinar. Then also from the Pharmaceutical Society side, I would like to thank the Vice President, who led the team, and also the chairperson of the Membership and Practice Committee, Mr. Martin Kampamba, for putting in the best. The presenters, Madam Constance, Mr. Kachali, senior member, for this wonderful presentation. but also to appreciate the general members, for attending, because I mean, you've made it a success. And I can say we have other colleagues from around the world, like we have friends from Zimbabwe, from Fiji. This is wonderful. This is as it should be. And I can tell you from the Pharmaceutical Society of Zambia, we treasure this partnership and this relationship. And we hope that we'll be able to move forward with this mutually beneficial relationship. So with those few words, I would like to hand over back to Mr. Morton Kunga to close the meeting. Thank you very much.
Thank you very much, Mr. President. Sonia and the President Pharmaceutical Society of Zambia, I think we are taking this opportunity also to have our collaboration be launched. This is a collaboration between the Pharmaceutical Society of Zambia and Empower School of Health. So there is a partnership that has been established, and a memorandum of understanding was signed. I'll need again a word from Empower School of Health, just in line with the partnership that has been established.
Thank you, Morton. Yeah, I'll just take it, Morton. Thank you so much. Thank you, Mr. Kennedy, for your lovely words. And we are also very happy to get, collaborated with you. And it's a long forward to go now. We will be working jointly in the region so we can empower millions, as our tag says. And I really thank you all the panelists, Mr. Martin, for all their efforts to have this successful webinar. Thank you so much.
Thank you very much, Sonia, and thank you everyone for participating in this webinar. And as it was highlighted by the President of the Pharmaceutical Society, we'll bring in more interest of us who continue supporting the society in ensuring that such kind of activities are implemented. So let us continue being part and propose topics and participate in all the ventures that we are having so that we can take our society forward. Once again, I want to appreciate Empower School of Health. Thanks to Professor Andy, all the facilitators, Mr. Kachali, Constance, for the job well done. And these are my final words. So have a good afternoon, good night, good morning, depending on where you are calling from. Thank you very much.